Good day, this is Dr. Jim Winship for Diplomatic Connections magazine. Thanks for joining us today. We're with Dr. Pamela Marzban at her strikingly modern dental offices in Burke, Virginia. Dr. Marzban, thanks for joining us for this interview and for this time together.
It's my pleasure. Thanks for being here.
Why did you choose dentistry as your profession? Most kids don't grow up wanting to be dentists, I guess, is what I'm asking.
That's very true. I think my biggest inspiration was my older brother. My entire family is in the health profession, and my older brother was the first one to go through dentistry, and I remember getting close to the end of college, and I was thinking about going into medicine like my father. I was doing research at the time. I didn't know if I wanted to stay with research, but my older brother was the one that says, I know my sister, you've got a creative, artistic flair. You like to spend your time with people, and this is a great opportunity. Why not dentistry? And I had just honestly never thought about it. So I went to different dental offices, and I just honestly fell in love with that patient contact. You know, with dentistry, you get to sit down and speak with your patients and get to know them, and you see them over and over again through the years. And that's really why I became a dentist. I love the people contact. I like doing the art of it. It's good.
That's maybe leads to a follow-up question, and that is, there are hundreds of dentists out there. What makes your practice, your office, your operation different from other dentists?
That's a good question. For us, the way we practice, our philosophy is just making sure that each person has a unique experience in the office, whether it's something as simple as a hygiene appointment or a smile rejuvenation patient. Every person is unique. Every experience is unique. So we have tremendous, not just myself, but my team, we have tremendous education and dental background. All the ladies that work for me are well seasoned. They've been in the field for a long time. And having a state-of-the-art facility allows them to have a lot of tools in their toolbox. So, for example, if you came in for just your cleaning appointment, you know, you're not just going to get the random cleaning. They'll know you because they're prepared for you. They read your chart. They'll know what they need to use for that appointment and follow up with how things are working for you. So I think it's just that true level of detail, the genuine care that not just I provide, but my entire team. And I think that's what really sets us apart.
Great. Can you tell us a little bit about your professional training and also about the role of continuing training, because just getting that diploma on the wall doesn't end your dental training?
No. Dental school, I went to Medical College of Virginia in Richmond, and dental school does a great job in giving you a good base. They can't teach you everything in 4 years, you know, but they give you a good solid background, and then it's really up to each dentist to start exploring things that they want to know more about. So our team and myself, we go to at the very least 3 or 4 seminars a year, whether it's here or across the country. We go if it's relevant for our patients. So after I finished dental school, I spent the next 3, almost 4 years, because what was important to me is people who want all this large aesthetic care, people who are suffering from grinding and have headaches, and we're just constantly giving them night guards. So I went to the Las Vegas Institute. It is a aesthetic center and neuromuscular center of training, and that's where I spent many years just going to course after course, taking patients out there, learning how to rehabilitate somebody's bite who's completely ground down, or someone who suffers from migraines. You know, as I see patients who come in with a lot of pain, and they've been to medical doctors, they've been tested for cancer, and every test that can be done under the sun, and they finally just get put on antidepressants or pain medications because no one knows how to handle them. And it was frustrating for me to see this, and I know that this could deal with the jaw posturing. So anyway, I know it's a long answer to your question.
No, it's a great answer, and it leads me to rephrase one of the other questions I was going to ask, which is on your website. You're practice is described as cosmetic and family dentistry. You just talked about neuromuscular, and we'll come back to that.
Sure.
But I guess most of us, when we think about cosmetic dentistry, think primarily about the look and having a beautiful smile, if you will. But your answer to the previous question sort of suggests that there's a link between the visual look of a smile and the physiology of the bite, of the way people's teeth are formed. How do those two things interrelate with each other?
That's very true. You hit the nail on the head. When people come in for cosmetic work, okay, and I'm talking like a smile rejuvenation, not just the tooth, because anybody can call themselves a cosmetic dentist, but somebody who truly wants a change, they're unhappy with their appearance. If someone's bite is off, it's just they have an unbalanced bite, you can't just put porcelain on their teeth and make it work. It's like building a beautiful house on top of an uneven foundation. That house is going to fall apart. No one's going to feel good, even if it looks good. If it starts falling apart, no one's going to feel happy. So you have to find a position or a balance with that bite before you can start really looking into the aesthetics of it. That's how the science marries the art to it, and there is a marriage there.
So the aesthetics and the physiology actually work together to create the end product that you want and that your patients want.
Absolutely, absolutely.
Good. Why are smiles important?
Jim, you know, the first thing people look at is either one of two things, their eyes or a smile. And I can't tell you how it impacts someone's life when they're uncomfortable with their smile. Imagine every time you've met somebody or you've done an interview, and if your smile was something that bothered you, that's one thing you constantly focus on. You put your hand out there and you have to worry about your smile. When you change someone's smile, you can change their entire well-being. You change their confidence. You change the way people feel. People cry. I mean, we make people feel great, and when we do those days, my whole team is just...
It may not show in the camera. I have to say there's almost a tear in your eye.
I get excited about it.
That's good.
Every patient, I feel like it's if you will, my first patient. It means the world to me, and it means the world to them. That's why my patients are so happy.
Okay, we've talked about cosmetics, aesthetics. What about the family part? Do you deal with entire families of patients? Do you deal with a full range of ages?
Yes, we see people from 3 and up, and I love my family practice. Cosmetic is one of our expertise, but the family is truly the base of my practice. Although this doesn't look like an old practice, it is an old practice. This is actually a 40-year-old practice. So I have had the pleasure of seeing kids grow up through my office. Some go through college, some get married. I've seen the grandparents. We still see families, and we love that. That's our biggest support in the community.
Great. So what do you mean by a smile makeover? I mean, it sounds a little bit like, forgive me, it's a bad analogy, but taking my car to the body shop, that they're going to make it over, they're going to pull out all the dents and things and make it look right again. But what's a smile makeover, and why is it important?
I think that's a great analogy. It's fantastic. What happens is, as adults, we've allowed our smiles to sometimes fall apart. Our smile gets darker, a little bit of crowding where the teeth get kind of jumbled up. As we get older, they start to get more and more crowded to a point that people either have an unbalanced bite that's causing them problems, or they're just really unhappy about the way they look. So if a patient comes in for a smile makeover or rejuvenation, I have to first find out what it is that they're unhappy with, Maybe you take your car in and you just want a nice new wax job, but maybe you just want a whole new color, or maybe you want to gut the whole thing. So yes, I have to examine them and make sure we're thorough about what we're doing, but it depends on what they want. Sometimes someone just wants whitening, sometimes they just want straightening, sometimes they need porcelain to cover up a lot that's happened through the years. So that's what we mean by that.
You talked about an old practice and a new office. I do have to admit, I expected Captain Kirk to walk through the door at some point. I mean, it looks a little bit like Starship Enterprise, if you will, at times. Well, I'm stretching a point, but how have computers changed dental practice in your life, let alone my lifetime, in your lifetime?
Computers have been absolutely fantastic, and we use it so often for patient education. There's different programs that you can actually go through and show patients, like let's say you need a crown, never had one, or you want to see a smile rejuvenation. We can show people what that is nowadays. One of the best things that's come out are digital impressions. What we use in our office are digital impressions. So we take a camera and actually scan the mouth rather than having to put that plastic goop in your mouth. And what happens is that gets sent to our ceramist.
You mean I don't get to bite down on things anymore?
You can, but it doesn't have to be impression material. Okay, we have better ways of doing it. And so what that does is it lets the it gives us a more accurate reading. You get a nicer, better looking fitting crown. So.
Now I have to ask, just because I went through this with my own kids who are long past this stage, but I noticed one of the things you do is higher tech or better quality mouth guards for kids and athletics.
Sure.
How are those different? I remember at home, dunking it in boiling water and sticking it in our children's mouths.
That's right.
To make those mouth guards, but you have a better way of doing that.
Sure. Those boiling bites, we call them. Most of the time, if you went and watched the kids play, they're sticking out of their mouths because they're not comfortable. They're big and bulky. So what we can do is make custom-made mouth guards, and the kids love them because they don't gag them so much, and they fit better. If they fit better, they can breathe better. That's why the kids push them out, because they're so heavy. It's a mouthful. And they like picking the different colors of their team. So they love that.
I had to ask, just because I remember that vividly from our kids.
Oh, sure.
The fact that they came in and out every play.
That's right. They're just hanging out of their mouths most of the time, right?
Yeah. Well, that's neat that there's a new way to do that. Here's another aspect of your dentistry that I was interested in, since I have a long history of dental fear, and that is sedation. You do sedation dentistry. Can you tell us about that, how it works, and what difference it makes for patients?
Sedation dentistry is explosive. I think people hear about it a lot, and that's because a lot of people had bad experiences like yours, and having that kind of impact early in one's life just keeps them out of the dental office. So what we do, we give patients, after a thorough medical examination, of course, we give patients medication before they come into their visit that helps them relax, gets them through the door, and they're of course brought in with a companion. But the medications we give them allow them to go through this process, whatever it is. Some people need it just for an exam even, or cleaning. Some people need it for long appointments. But we can tailor their sedation so when they come in, they're comfortable. They have little to no memory of the entire visit. They felt like they just slept through it. And it is completely safe because they're not put out. They think they're dead asleep, but they're not. They're just relaxed. So they breathe for themselves, so they're comfortable, and it's completely safe. That's what we use it for. People love it. It allows them, it gives them an option to know, if I need dental work, I can do it now. My sedation patients give me hugs. They're so happy.
I have to put in a disclaimer, which says that the reality has never been as bad as my fears over the years, and I'll just take that blame on myself.
But fear is legitimate, and everybody feels like, oh, I should be able to handle it, but you can't. And there's nothing wrong with that. If it just takes a little something to get you in through the door, fantastic. Sometimes we don't even use it for fearful patients, but these rejuvenation cases we've talked about, people can be in the chair having work done for about 4 hours. That's a long time. To sit still. And also the medications we provide keeps the jaw from getting sore and tight because, you've been open for such a long time. So we use it for different reasons.
Now, that also makes me think, as I looked at your website, you have a number of other amenities or entertainment devices or distraction devices.
Yes.
I don't know. Can you tell us a little bit about those? I mean, for patients while they're in the chair.
Sure. Let's face it, nobody likes being in a dental office. As much
You
as
do.
I do, I love it. But this is my home away from home. But we do things like we have My View glasses where we downloaded different movies and shows that people can sit back and watch a show like 30 Rock while they're getting their teeth cleaned. We have Pandora, which is internet music with, noise trapping headphones, if you will, so they don't have to hear the drill.
Yeah,
it really
the
doesn't.
big padded cans.
The big, yes, the big ones. And sometimes people bring in their own iPhones and hook it up to that, or sometimes we just plug it up to our docking system, and that really helps them. Makes the time go by faster. Simple things like blankets or neck pillows or just scented oil so it doesn't smell like a medical or dental office. Those are things that just make people put them at ease, makes them feel comfortable. A lot of my patients, when they come in, they've referred people. The people that came in for their first exam, they said, so-and-so was right. This is such a friendly office. This is almost fun, for a dental experience. That's a nice thing to say.
So that's another side of patient care, quite apart from the clinical side, that adds to the experience and reduces that fear as well.
Jim, I think that is almost just as important. It really is. We're treating people. It's not just teeth and gums, right?
Right. Now, I know, again, there are all these technical terms, and help me work through them. Okay, we've talked about cosmetic, we've talked about sedation, neuromuscular dentistry.
It's a mouthful, right?
Well, no pun intended.
That's right.
But what is that all about? I mean, for example, I noticed on your website, you list sleep apnea as a condition that you can possibly treat in any case. How does all of that go together? I mean, this neuromuscular stuff. That's not a term I heard my dentist as a kid use at all.
It's not a term that a lot of dentists in this area actually know and recognize. That's where I did most of my training, was at the Las Vegas Institute, and it's more of a West Coast concept. The concept behind neuromuscular dentistry and what makes sense to me is that if you think of this area right here, think of it like a triangle, an equilateral triangle, and there's a balance there. On each point there's something. At the top of the point is this joint, your temporomandibular joint. On this corner is the muscles that posture your jaw in space. And on the last corner are the teeth. Now the teeth dictate, when you put your teeth together, okay, they stop this jaw in space. So what neuromuscular dentists do is they find out where to posture the teeth to keep the muscles that posture your jaw in space comfortable. It is a physiologic position. It is a healthy position. That's all it is. Find a place to keep the muscles happy and then put the teeth there, and then the balance is complete. The joint articulates correctly, the muscles are comfortable, and the teeth are where they need to be. How does that fall into play with sleep apnea? You can imagine people who, for example, they have a jaw posture that is pushed back. Well, if your jaw is pushed back, what happens to the tongue? The tongue is a big muscle. The tongue gets pushed back and it closes the airway, especially when we breathe. So a lot of people use these machines called CPAPs, right?
Right.
It's pressurized air to force the air in. People either love or hate them. It's a love-hate relationship.
It is.
Because it's a baseful, if you will.
Right.
But what we can do as dentists, if you have the training, is create devices that posture your jaw forward. Okay? Just bring that jaw forward. If the jaw comes forward, the tongue gets out of the way. You have more airway to breathe.
Oh, interesting.
That's how.
Now, it also ties to things like migraines, to headaches.
Absolutely.
And back pain, all those kinds of things.
This jaw, the muscles that posture your jaw in space are the same muscles that posture your head and neck. Okay? So imagine for every inch your head is postured forward, and so many of us have this forward head posture, it's 10 pounds of extra weight on your neck. So you can imagine how much stress that puts on your shoulder and neck all day long. Okay? So if your jaw is postured in the correct position, your overall posture is better, so you have less neck and back pain. In regards to the migraine, it's all about the muscles. That's the neuromuscular background.
Okay.
It's all about muscles. If muscles are made out of fibers. If a muscle is over constricted or over lengthened, it chokes the circulation that provides oxygen to the muscle, right? That's where we have pain. We get lactic acid buildup. The people who suffer from migraines here or headaches that come from back here, those are all jaw posturing muscles. If you can get those muscles in an equilibrium where they are at the right or correct posture, the circulation improves and magically the pain disappears.
Now, do you work with, for example, with people's other doctors, say they're internists or a GP that they're serving as their primary care physician? Will you work together on these kinds of conditions, for example?
Remember, I was telling you a lot of these patients come in with on pain meds or on antidepressants. So before I get started with the patient, I've already discussed things with their doctors, and ideally we're trying to wean them off these pain medications and antidepressants. If there's no clinical reason for them to be on it, we should be able to get them off these medications, okay? So sometimes I work with medical doctors in regards to that. Sometimes with children who have, a lot of times the medical profession doesn't look at the tonsils anymore, and these kids come in because their tonsils are so inflamed. Why are you laughing?
I'm laughing because they told me I could have all the ice cream I could eat when I had my tonsils.
You remember that,
they
right?
They don't tell me you couldn't keep it down.
Oh, is that right? Okay. So it brings back memories.
It does bring back memories. But thinking about it, for my generation, you know, this generation's grandparents, if you will, tonsils and adenoids were a pretty routine operation.
All the time.
And you never hear about that anymore.
It went from one extreme to the other. Why can't we look at everybody as an individual? The kids that I see in my practice, if I see a child come in and they've got the dark rings under their eyes, or when they're just sitting still and their mouth is open, the tongue is slightly forward, I know they're mouth breathing, and they're mouth breathing because their tonsils and their adenoids are probably enlarged. Why can't we just take an x-ray to check that airway? If that tongue is postured forward, it's going to also affect the way the skeletal development occurs, right? Because if the tongue's a huge muscle, it keeps the palate, which is the roof of our mouth, more flat. And when the tongue's out and out of the way, that palate comes up, which makes this part of the jaw shrink in. All our 6-year-old, 7-year-old kids are getting what? They're getting palatal expanders to push the palate back out.
Fascinating.
You know?
So
you have to look at everybody as an individual. So a lot of medical doctors with my kids.
So maybe the old surgery isn't completely obsolete.
It's not obsolete. You have to look at these kids, the ones that suffer from milk allergies or pollutants in the air, the ones that are always congested, they're not breathing. And if it helps to open their airway up, just take an x-ray and see what that airway looks like. So yeah, we work with medical doctors for different reasons.
Let me flip that question around, and that is, when do you refer patients to another dental specialist or to another doctor? I mean, what don't you do, I guess, is a way to ask that question.
I always feel if someone can do it better than me, they should do better. They should do it. Okay, so if there's something, whether it's a root canal or an extraction, something that I think I'm going to struggle with, I shouldn't be doing it. And that's when I refer. I've got a great group of surgeons I work with for implants or wisdom teeth extractions, great endodontists, root canal specialists, things that are truly outside my expertise, I will send them out.
Okay. What tooth whitening? We hear so much about it. We see the ads on television. It's on your website. It's on virtually every dentist's website now. And I can also go to the drugstore and buy it out of a box. What's the difference between going to the drugstore and buying the out-of-the-box treatment and what's available in your office?
Going to the drugstore and getting the out-of-the-box is good if you have very little staining of the teeth. Most of those products, they remove external stain, like coffee, red wine, whatever you care for. They help to remove those stains, but they cannot permeate or get into that enamel and break down the stain molecules and actually allow the tooth to whiten. And what's unfortunate, I've seen some patients get pretty decent results out of Crest White Strips are a good one, but a lot of the times these products come in denatured to the stores. That's why one box might work great and the next box won't, because they come in a hot delivery truck, they might be expired, or like I said, denatured. Now, in a dental office, if you come in to have it done here at your dental office, what will happen is that your dentist gets to look at your teeth, because let's say you have a crown here or a filling here, you're going to have some limitations. So it's more customized for you, it's more tailored for your mouth. You know what your expectations and your limitations are going to be. The material is not even comparable to the over-the-counter. It's so much stronger, and it gives you that opportunity to get into the enamel and break down those stain molecules and whiten the teeth out. So that's really the difference. It's customized care, the stronger product.
Okay. Veneers, another term we hear all the time. What is it exactly? How does it work? And when do you opt for veneers versus just whitening the existing tooth?
That's a great question. Veneers are used, whitening is if you have nice looking teeth, but they're just darker. That's all you need. You just need to whiten them out. But people who have unattractive shaped teeth, like very, worn down or bell-shaped teeth with gaps at the gum line, or people who just have a lot of restorations on their mouth, and it makes their teeth look like, their smile look like a potpourri of different products in there. Those are ones that actually need a facing, like some kind of something to cover it up. And that's what a veneer does. It goes over the front of the enamel and covers it up. And there are so many different types of veneers out there. You just, again, have to look at the person and see what that individual would need.
Okay. And a related question, but sort of, I guess, the next stage beyond veneers, implants. Is that something you do, and when do you opt for implants? I have to tell you, when you see the advertisements and you see the substitute for a root on the implant, it's a little scary.
The concept is horribly scary. I never like having to tell a person you're going to lose a tooth, but I love telling them that you can do an implant and not a denture now. Dental implants is something we absolutely do. It is one of the best things that come out in dentistry in the past 20 years. It is a simple process. It's actually very seamless once you can get over the fact you're going to lose a tooth. What we use in our office is, again, computer programs to give you an idea of what the process will be like. And quite often I do utilize the help of a specialist, an oral maxillofacial surgeon or a periodontal surgeon, and I work with them as a team.
Because in this case, you're actually going into the bone. Is that right?
Yes. We're using a titanium post, and it goes into the bone, and my belief is you need to let that titanium heal, and then you can put a prosthesis like a crown or a bridge on top of it.
I see.
If you're missing one tooth and you have two perfectly healthy teeth adjacent to it, we don't have to whittle down those teeth and put a bridge on it. Having the family side of my practice, I get to see a patient now and think of them when they're going to be in their 80s, when their dexterity may not be there, or they might be afflicted with Alzheimer's. Implants are things that they don't have to worry about because it's easier to keep clean. You can't get decay around it. It's not a magic bullet. You have to keep it clean, but it's much more.
It's a big improvement.
It's a big improvement, yes. Yeah.
Well, again, my generation, most of us have fillings left over from when we were younger. Are those fillings dangerous? I mean, should they be replaced? We hear about, the old, and I know I've had them, the old amalgam fillings that I guess had mercury.
Absolutely.
In them. Are they dangerous? Is that something people need to think about getting replaced?
We know that mercury is carcinogenic. So if someone needs to have a filling redone or upgraded, I don't use any kind of mercury fillings in our practice. It can cause other issues. You have to be tested to see if you have a hypersensitivity to mercury. It's been linked to Alzheimer's, it's been linked to MS, but it's worked for so long that it's very credible. I don't use it because there are better options. Mercury in those amalgam fillings, amalgam by definition means a combination of things. So it's an amalgamation of different metals. Mercury was used to kind of keep it all together. It's soft and sticky. And every time, if you have a mercury filling in your mouth, every time you chew, you release mercury in your mouth and you ingest it. Every time that surface is grazed all day long. So mercury is not the best option. Any type of mercury fillings we just don't do in our office. What is also dangerous is that mercury causes teeth to crack and fracture. We use mercury in thermometers, right?
Right.
Why do we do that?
Because it expands with heat.
Exactly. So what does it do in our teeth?
So
Enamel doesn't
I never
do
thought
that
about
same
that,
way.
but it's expanding and contracting, which is probably why those old amalgam fillings come out sometimes.
They come out, or people need crowns because their teeth are cracked. It's seldomly, I hardly ever take a mercury filling out and not see a crack underneath the surface, unfortunately. So.
All right, here's a question I've waited till now to ask. Okay. Dentistry is not inexpensive. What about the costs of dentistry, and how does your office help people handle those costs?
You know, dentistry hasn't changed that much in terms of expense. You can still find a dentist who's going to maybe do that $85 mercury filling for you. The reason why it seems so expensive is because our options are just that much more. We could not do a $25,000 implant supported titanium denture before. You just got your $2,000 denture instead. So it's really the availability, the options that have made it seem so expensive. But with the way things are, with the economy, the way it is, not everybody has that much money to spend on their health, unfortunately. We are a family practice. It's been around a long time. We try to work with patients we know uncomfortable. We actually allow them to split up payments. Other people who need long, have big treatment plans that need to split it up over a long period of time, they can use third-party financing that target dentists because they know people need dental health, dental care. And so they can do their financing through them.
People aren't signing their firstborn over to you or anything
no,
like
I
that.
have 2 kids of my own, and I don't need any
You're not
more.
taking
And we're,
any
no,
more.
no, we're good. Thank you.
I'll ask 2 last questions. One is just to ask a little bit more about you. Looking on your website, there's some pictures of you with, magic marker numbers on your arms and things. You're a triathlete, is that right?
I just try to stay in shape. I try to stay in shape.
That's more than staying in shape.
I'm very close with my family. My older brother, he is a triathlete, and he just ran his 2nd Ironman. Very proud of him. But he got us into doing small sprint triathlons. So it's just a way of keeping my mind and my body healthy. That's all it is. Try to get out there and do something good for your body.
So if we drive by the office and see you jogging around the parking lot, we know you're filling time.
There you go. Yeah, there she goes again, guys. Someone slow her down. But it's fun.
Let me take you back to the beginning for a last question, and that is back to the importance of smiles and dental health. Why do you think those things are so impactful on people's lives? I mean, we hear cardiologists, after all, work with our hearts. We hear things about, cancer surgeons and so forth. Smiles and oral hygiene aren't necessarily the first things we think about. Why do you think they're so important?
If someone has a nice smile, they tend to take better care of their oral health. And your oral health does affect your cardiovascular health. If your mouth, if your gums are constantly inflamed, it causes the same hardening of your arteries as cholesterol does. And we do spend a lot of time teaching our patients that. So whether you want to just feel good about the way you look and improve your self-esteem and self-confidence, which to me are one of the most important attributes in anybody, or whether you just truly care about your well-being and health, I mean, it goes hand in hand. You have to, it's so important to me. This is what I do. This is what I breathe.
I understand. But I think that point is worth making over and over again. It does go hand in hand.
It does.
That those things are part of overall health as well as part of the how you look, how you feel, the amount of self-confidence you have.
Absolutely.
And that's an important message, I think, to get across.
Absolutely. Even if it's just straightening, if you think if your teeth are straighter, you can keep them cleaner better. not just now, but when you're older.
Mm-hmm.
You know, you have to set yourself up in life so that you're taken care of later in life.
Great. And how do people contact you?
They can find us through our website, which is marzbandds.com, or they can call us at 703-323-8200.
I thought I'd let it come from you rather than from me. Thank you so much, Dr. Marzban, for spending this time with us today, and for sharing your thoughts about the importance of dentistry and how it's changed and why it's so important. Thank you.
Anytime. Thank you so much for coming.
My pleasure.